In Fox 5 Health News tonight, a popular hair loss medication may cause serious side effects. Researchers say the drug Propecia, used for male pattern baldness, could cause severe depression.
All right, let's find out more about this. Joining us right now to talk about it is Dr. Keri Peterson from Lenox Hill Hospital. Thank you so much for being here.
Great to be here, Ernie.
Yeah, this is quite a story. I mean, a lot of men are on this drug. So tell us more about the study. We talked about depression, but there's more to it as well.
Yes, there is. This looked at a very specific population of men. It's men who experienced sexual side effects from Propecia that continued after they had stopped the drug. And they surveyed these men, and they found that about 36% of them were severely depressed, and 44% of them had suicidal thoughts.
Wow. Why do you think this is happening?
Well, the authors propose that it's either because the sexual dysfunction itself is causing men to feel depressed and suicidal, but another theory is interesting. It's that finasteride can cross into the brain, and in the brain it's known to lower chemicals called neurosteroids. And low levels of neurosteroids have been linked to depression. So perhaps it's hypothesized that the drug itself may induce these behavioral changes.
So we got to watch that carefully, don't we?
Absolutely.
Yeah, okay. Let's talk about another very interesting study involving men here again. And what sometimes attracts them to those of the opposite sex. It's kind of an interesting study about who they're interested in at a certain time or period in their lives. Why, exactly.
That's right. It looked at how the environment influences men's preferences in women. And they looked at it, it's a small study, and it's not definitive. It looked at about 81 men, and it put half of them under stressful situations and asked them to rate the attractiveness of women of varying body types, and they tended to prefer heavier women in those circumstances.
Does it have to do with their self-esteem, or?
Well, self-esteem is thought to be one of the theories. In this particular situation, perhaps the men had a temporary blow to their self-esteem, and in Western culture, unfortunately, there is more of a preference for a thinner set woman, so perhaps this temporary blow in self-esteem made them less likely to reject a heavier body frame. But we do know evolutionarily that the environment can influence men's preferences, that it's not hard fixed, that they are flexible in what they prefer.
I thought they were attracted to people who were like their mother or something like that.
Oh, that's another thing. That's a whole Freudian theory.
That's another thing. But we had kind of talked about this a little bit, and perhaps some men feel that, you know, that they're in less competition with someone who may not be quite as attractive. And their self-esteem will be okay because they won't be rejected.
Well, that is another factor as well.
Yeah.
And actually, when you look at some studies, there's so many factors that are involved in what a man prefers. But for example, in countries that have scarcity of food, men are absolutely known to prefer fuller-shaped bodies of women because they're known to produce better, produce babies better, reproduce more easily, and they're also more likely to survive in food-scarce environments. And here in Western culture, oftentimes very thin women can be viewed as more frail and more likely to get sick, or perhaps less likely to be able to reproduce as well.
All right. Well, when you come back again, doctor, you're going to have to tell us what women prefer. So
oh, that's a good one. We'll have to look at those
sides of the story here. Very interesting study, though. We get a lot of conversation on this tonight.
It certainly should.
All right. Dr. Keri Peterson, thank you so much for joining us as always.
Thanks, Ernie and Sharon.
See you next time.